Gentleman yields, and now I call on Ms. McBath from Georgia for her line of 5 minutes of questioning.
Thank you, Chairman Allen and Ranking Member DeSaulnier, and thank you to our witness today. The Employee Benefits Security Administration has the important responsibility of protecting the health benefits of more than 150 million hardworking Americans on employer-sponsored health insurance. Unfortunately, a growing number of Americans who have actually put in their time at work and paid into their health care plans are not receiving the benefits, the health care benefits that they are entitled to. With the increasing complexity of the healthcare system, the Employee Benefits Security Administration's responsibilities have grown significantly over the years. Yet the agency remains chronically underfunded and understaffed, with the President's newest budget requesting a further $10 million cut to an already overworked agency. The lack of resources at this agency means that patients continue to face cruel and unnecessary delays that limit access to necessary life-saving care. In the last session, Congressman Rick Allen and I sent a letter to the Employee Benefits Security Administration regarding our concerns about the role of alternative funding programs in self-funded plans. Under the guise of saving money, alternative funding programs misled employers and pushed them to plans that ultimately exclude certain specialty drugs or deny timely coverage for covered treatments. These middlemen abandon patients, pushing them to patient assistance programs that are not meant for them, or pressuring them to use illegal importation methods. Ultimately, and far too often, these alternative funding pathways fail our patients, leaving them to shoulder the full cost of their life-saving medication or experience delays that can result in harmful complications. Like a cancer patient who relies on an oral oncolytic when they know other therapy actually works. Prior authorization deemed this medication medically necessary, but the patient's alternative funding program denied coverage for the treatment, forcing the patient to jump through unnecessary hoops that caused him to miss treatment for an entire month. Or like a cystic fibrosis patient who relies on a modulator therapy, which is critical for treating their chronic disease. Because of an alternative funding program, their covered treatment was denied, resulting in a 6-month gap in their care. 6 months. 6 months of waiting that resulted in irreversible lung damage that caused the patient's health to deteriorate, ultimately forcing them to be hospitalized and leave their employer plan to find coverage on the marketplace. Assistant Secretary Aronowitz, do you think that it is acceptable for an employee who is entitled to health benefits through their employer to have to wait for 6 months for life-saving treatment?
Thank you for that explanation. I agree with you. It's outrageous. And if the facts are as you stated, that's wrong. And I took this job to remedy exactly what you just articulated. I have challenged all of our investigators, our great head of enforcement, our regional directors. I told them, find more healthcare cases to use the full power of ERISA, which includes improper claims denials, and we're going to hold healthcare companies accountable. These promised benefits to Americans must be upheld. That's my job, and I guarantee you I'm doing it.
I'm glad to hear that, because no one should have to wait for life-saving treatment. And the reality is not everyone can wait for the life-saving treatment. And while the agency is tasked with this important role that has financial and profoundly personal impacts for all those who in our healthcare system, that they're in our healthcare system, years of underfunding and understaffing have threatened to undermine that mission that you speak of. Assistant Secretary, I share your vision of making the Employee Benefits Secretary Administration more efficient and more fair, so that patients are not left hanging while bills are piling up and life-saving treatments go delayed. With your commitment to improving the efficacy of the agency, I hope you will provide timely oversight into alternative funding programs. Their conduct hurts both employers and employees alike, misleading employers and leaving employees in the lurch. Patients are not getting the answers that they need. Claims continue to be denied, and more Americans are left without the treatments that keep them healthy and keep them whole. On behalf of the millions of Americans who rely on health insurance through their jobs, it is our duty, your duty as well, to support oversight, cut through red tape, and protect patients' lives. And I yield.